All of us, rich and poor, black and white, are equally susceptible to mental illness. And we're all one tragedy away from a mental health crisis because we're human, but not all of us have equal access to mental health care.
Congressman Ritchie Torres is the first openly gay Afro-Latino to serve in Congress, and his district in the Bronx is one of the poorest in the country. He says issues surrounding mental health are a priority and resonate deeply with him, and he's extraordinarily candid about his own struggles.
Like many low-income people, I was facing barriers to accessing mental health care. More than a decade before entering public office, I found myself at the lowest point of my life. I had dropped out of college, found myself abusing substances, thought of taking my own life because I felt as if the world around me had collapsed. I even underwent hospitalization for a period of time, and I never thought in my wildest dreams that I would rebuild my life and then eventually become the youngest elected official in America's largest city. My life is living proof that even in your moment of greatest despair and darkness, never lose hope.
And not just in the Latino community, but in the Asian community and so many communities of color.
We have to raise awareness about the true nature of mental illness, depression, anxiety. Educate the public that these are not character failings, but true diseases and disabilities that require treatment. You're no more to blame for your depression than you are for your inability to generate insulin as a diabetic. We have to think about depression in the same sense that we think about physical illnesses. And frankly, it can be even more crippling than physical illness. Because depression at its worst cripples your ability to live.
And that you could wave that wand that you think would really help mental health access. What would they be?
Every school should have a school-based health center. We should be investing in the training and hiring of more psychologists and psychiatrists to break down barriers to mental health care. And then we need to put in place policies that are specifically aimed at those with severe mental illness. The policy of America is to allow those with severe mental illness to simply languish and die in our jails and prisons or in our streets and subways. We need more inpatient and outpatient care for those with psychosis, with severe mental illness like schizophrenia. So I feel strongly, the love and support of your friends and family is an important part of the equation. There are mental health centers known as clubhouses, which are geared with those towards serious mental illness.
And this is free to people who go?
It's a free service, often publicly funded, but privately provided.
We want people to have a place where they can build relationships, reduce isolation, and learn that this is a safe place. So clubhouses is a great example of a socialization that is helpful.
Dr. H. Gene Wright II is Deputy Commissioner of Mental Hygiene for New York City. He says his objective is to gain awareness of New Yorkers' mental health and environmental factors that shape their daily lives, and to meet the diverse needs of residents.
We certainly want to, again, meet kids where they are as well, and one of the great programs that we have is Teen Space, and those individuals have an option to talk or chat if they like, and we've serviced over 20,000 New York children, young people, that have accessed that service. The most important thing is having 988 available. And so you don't have to know exactly what you need. We're there to help you make that decision. There's a counselor, someone there that has expertise that you can ask questions, you can text, call, chat. Every single New Yorker who needs it should have access to services. And so my goal is to make sure that we stick closely to our Healthy NYC plan, which is to reduce overdose deaths by 25% by 2030, to reduce suicide deaths by 10% by 2030.
A mental health report issued by New York City says about 1/3 of New Yorkers who have a mental health diagnosis report unmet mental health needs. That includes not receiving treatment they want, not getting it as soon as they wanted, or easily accessing it. They also say treatment access varies widely by community, with Asian New Yorkers utilizing it the least.